Hello and welcome to this brief introduction regarding the CBIC exam. My name is Inja Abdurraouf and I will be with you in the coming few minutes regarding this introduction. In this session we'll talk about the CBIC, what is the CBIC, why it is important to be a CIC, what is required to apply for this exam or the eligibility requirements, the content outline for the CBIC exam, the fees of the exam, the study sources, the recertification, and how to apply for the CBIC exam. So first, what is the CBIC? Of course, all our knowledge here is derived from the candidate handbook, so it is advised if you are willing to sit for this exam to visit the website for cbic.org and download the candidate handbook. The CBIC stands for Certification Board of Infection Control and Epidemiology. It is the most powerful certificate regarding infection control. The certificate is offered by this board. The CBIC is an affiliate with the EPIC, or Association for Professionals in Infection Control and Epidemiology. And this association is the leading professional association for infection preventionists. Why is it important to be a CIC? Okay, according to the WHO fact sheet, we have hundreds of millions of patients affected by infections worldwide. And over from 100 hospitalized patients, we have 7 who acquire healthcare associated infections in developed countries versus 10 who develop healthcare acquired infections in developing countries. Of course, this affects greatly the morbidity of the patient, the mortality events that occur, and consequently the financial losses of healthcare systems. So it is highly recommended that we should apply infection control in all our healthcare facilities. And for applying this, we have to hire individuals who are greatly professionalized in this specialty. And the CIC's credential demonstrate that you are the one specialized to undergo infection control procedures. So many of the healthcare facilities who are acquiring accreditation by the Joint Commission have the standard that an infection prevention and control specialist should manage this program in the facility. So many hospitals and many healthcare settings are searching for CICs to take care of their infection control prevention program and to pass this standard during their survey process. A CBIC exam is recognized by the EPIC and the IPAC for Canada as the standard for certification in infection control. If you visit the website for CBIC, you will find a great presentation they prepared regarding understanding the credential and why is it important to be a CIC certified. So I recommend you visit this website and download this presentation. What are the eligibility requirements? Of course, for applying for this exam, you have to be currently working in as an infection control and preventionist in your healthcare facility, and you have to be currently working in a healthcare facility. Besides that, you should have a minimum baccalaureate degree or certified healthcare professional degree. Besides, you will have had been working in this facility as an infection control professional for at least 2 years. These requirements, you will be required to submit for the board some documents that prove these requirements. So one of the documents that you will have to submit is the attestation statement, and this statement is downloaded from the website of the board and is filled by your supervisor. It indicates or verifies that you are currently working in the field of infection control in the facility, and the supervisor is required to add his email, work phone and address so that the board can contact him and make sure that this applicant really has the experience and works there. So what if I'm not working now in healthcare facility, or I don't have this required experience? In this case, you can offer consultation in certain facilities, healthcare facilities, and the owner of this facility will fill for you the client attestation statement. You will be required to apply or to submit to the board 3 of these statements. And these statements will not be submitted by you, but by the person who completed them. So if I'm making consultations or offering consultations in infection control for a dental clinic, so the dentist of this clinic will fill this statement and will send it directly to the office of the CBIC. You will need to complete 3 of these statements. The outline for the exam, according to the recent handbook 2016, it is mainly 8 items or 8 domains. Identification of infections, and you'll find 22 questions for this topic in the exam. Surveillance and epidemiologic investigation, 24 questions. Preventing, controlling the transmission of infectious agents, 25 questions. Employee and occupational health, management and communication, education and research, environment of care, cleaning, sterilization, disinfection, and asepsis. All these items are included in the exam outline, and they cover a total of 135 questions of the exam. The exam actually consists of 150 MCQs, and the exam, of course, is computer-based and offered in English language only. In the exam, you will have to solve 150 MCQs in 3 hours. 135 of these questions will be scored, and I mean by scored that the result will be from 135. The 15 other questions are called pre-tests, and they are not scored. They are just testing the understanding of the candidates for these questions, but they are not scored yet. Of course, during answering the exam, I cannot determine which question is scored or which question is pre-test. You will have to just answer the 150 questions in the 3 hours. The fees of the exam is $350. From the time of having the confirmation notice from the board that we are eligible for taking this exam, you will have 90 days to enter the exam. If the 90 days passed, you will have to reapply again for the exam. The passing score is almost 75%, which means that I have to answer 101 questions correctly over or from the 135 MCQs offered. The passing rate for the past years, according to the CBIC, is almost 65%, which is good for board exams. The references to study from. We have the main reference, which is the EPIC text. The EPIC text is offered in 2 versions or 2 methods. There is the one which is hard copy, and you can buy the other one, which is the soft copy or the online copy. Both are great, both are beneficial for studying, and it is again the main almost source for our study. We have other sources like recommendations from EPIC, like guidelines and standards from different agencies, like the Red Book for immunization pediatrics. Of course, there are many other references for infection control, and this science is greatly changing over time. And I think many of you have heard about the Zika virus these days. Of course, Zika virus is not yet mentioned in the EPIC text, but of course it can be questioned. They can question you in the exam for the Zika virus. So you have to be updated most of the time, updated what is recent, what's going on in the world concerning infections and methods of control. The recertification process starts every 5 years. So if I'm examined today and I succeeded in the exam, my certificate will be eligible or working for 5 years. After 5 years, I have to pay for recertification and enter a new exam for recertifying. The exam is 150 multiple choice questions, the same as the original exam, also computer based, but the difference is in two things. The first thing is the fees is less by $25. I think this is not a big issue. And the second thing is that the time is unlimited, unlike the main exam. So we have to enter this exam following the 5 years in order to have our CIC credential updated and working. How to apply for the exam? First of all, you have to prepare your documents. Prepare your baccalaureate degree or the proof of current license, your job description, and the CV, plus your attestation statements. All these will be prepared, and you will enter or visit the website of cbic.org, select examination application, and start filling the application, and of course uploading the 4 documents. After doing this, you will have to do the payment, and this of course requires a current Visa card or MasterCard, okay, which will be ready in your hand and covering the fees of the exam. After filling the application, and within 7 days, you will receive an email from the board stating whether you are eligible for joining the exam or not. And this will be called the confirmation note or the confirmation email. Within 90 days, you will have to schedule for your exam. Again, if the 90 days passed, you will submit a new application, reapply for the exam from the beginning. So we'll upload our documents and pay for the exam and so on. So please don't register for the exam unless you are ready for doing this. Then you'll take the exam in the stated location, and don't forget that you will have to recertify after 5 years of your initial certification. Okay. I wish this video was helpful and this presentation helped you in understanding the CIC credential and the exam. Thank you so much for listening.